So speaking of stress and strain on the tendons and ligaments of the neck and the low back, it doesn't really require constant strain. It's time dependent. So it does make a difference if you're sitting 1 hour, 2 hours, or even 8 hours at the computer, or for instance using your phone. There is a concept today called text neck. Text neck is when you're bent over like this, constantly using the phone or an iPad, so many of us do every single day. And what that basically does is it takes the curve of the neck, which is really supposed to be a backward C curve, and it forces your neck this way. And by doing this constantly all day long, what you're doing is you're putting pressure on the back of the spine, and you're actually inviting the disc in the back of the spine to bulge backward, and then start putting pressure on the cervical nerve roots. So then you may begin to experience headaches. You may begin to get numbness and tingling in the arms and hands. You may have pain radiating down your back. That's the concept of text neck. So some of the exercises that I'm going to show you are going to help reverse that, the tendons and ligaments, and bring the spine back into the proper alignment. Similarly, the low back is again meant to have a backwards curve. And sitting at a desk improperly, if you're sitting and you're not supporting the low back, can cause the spine to lurch forward like this, again inviting a disc herniation. Where you may have a bulge like this, pushing on the low back nerve. That causes sciatica or some other low back pain. So the phenomenon that I'm talking about is called creep. And it's basically when you sit at your desk or you do any movement in terms of activities of daily living that asks the ligaments and tendons to stay too long in a certain position, and then they begin to forget on a subconscious level how to be able to do what they're supposed to be doing. In other words, head upright, shoulders back, stomach in. This is the proper position that you should be standing and sitting at. But when you've been sitting like this all day long, or slumped forward like this all day long, you begin to take the curve out of your back and out of your neck, and the tendons and ligaments forget because creep is now set in. The longer you do that over a period of time, the longer it takes to reverse the effects of what you've just done during the day. So let me talk a little bit, going back again to the concept of reversal of time exercises that I give to a lot of patients. It's going to require, first of all, that you set a time reminder to yourself at your computer. Either set a little tickler system or an alarm clock, whatever works for you, whatever gets you going and up and out of the chair. Go get a glass of water every 60 minutes, which again is another great way to rehydrate the spine, because the spine really doesn't have a whole lot of ways to get water, and that's one of the classic ways that it begins to degenerate down is through dehydration. But so going back to the concept of time exercises, set your computer for every 60 minutes. You're going to need a 5-minute break to reverse the effects of what you've been doing for the last 60 minutes. So you're going to start by doing an exercise called Brugger's. And that exercise basically requires that you bring yourself out of this position that you've been sitting backwards in the chair, all the way back, leaning forward like this, and you're actually going to bring yourself to the very tip of your chair, where you're actually sitting with your tailbone at the very edge of the chair. So you're going to put your tailbone at the edge of the chair, keep your feet, your legs at a 45-degree angle, bring your spine completely up, looking straight ahead. You're going to reverse your arms out and put them right on your knees, because this is opening up the pecs. The pecs are very important to get opened up. This is another problem with text neck and people that sit at computers. The pecs begin to get contracted down, and then your lymphatics aren't flowing, and your lungs aren't opening up, and you're not getting oxygen into the body and into the muscles that so desperately need it. So part of this exercise is to reverse the effects. You're going to turn your arms out like this. You're going to place your nose up to the ceiling at about a 45-degree angle, and you're just going to take 15 breaths. Breathe in deeply through the nose. Feel the air go all the way down into the lungs, and then exhale. And when you exhale, you're going to bring your shoulders back and down. So do that again. Deep breath below the diaphragm. Fill the stomach with air and breathe out. Another important reason why we do this is because when the body is under stress, and that's most of us under a daily workday, we do shallow breathing. We only breathe down to the diaphragm and no further. But we really need to be able to take in breath all the way down so that we can oxygenate the muscle. So again, you're going to breathe in, shoulders back and down, breathe out. You're going to do this 15 times. The next exercise that I'm going to have you do is to take your neck in simple ranges of motion. You can stand to do this or sit at your chair to do this. And essentially what you're going to do is you're going to look to the right as far as you can comfortably. You're going to look to the left as far as you can comfortably. You're going to look straight ahead, up at the ceiling. Ideally, the nose will be touching the ceiling or pointing at it. And then you're going to look straight down. Then you're going to look behind your body. You're going to do a gentle stretch for the low back and the neck. And you're going to look the other way. And you'll go through this ranges of motion 2 to 3 times. No stress involved. Don't push yourself past the limit. If you're in pain, reduce the amount of turning and flexion and extension you're putting in your spine. So again, 2 to 3 times with the neck ranges of motion. And this is just so that your body remembers that it has other movements. It does other things other than this and other than this. This is part of reversing the reversal of time exercises, reversing the effects of activities of daily living. The body ages in a flex forward position. So one of the number one things that we can do as our body begins to age is reverse the effects of flexion and begin to put our bodies in extension. Stretching, Pilates, calisthenic exercises are one of the most important things that we can do for our body as we begin to age. Weightlifting is good too. But I would put even calisthenics and stretching much further ahead of the game as the body begins to age, because the tendons and ligaments dry up and they forget what they're supposed to be doing. The next exercise that I'm going to have you do is called Mackenzie. It's going to be where you put your hands right in these 2 little bony parts of your back. And you're going to look up at the ceiling, because this is an exercise for the abdominals. This is an exercise to reverse the effects of the neck. And this is also an exercise to reverse the effects of the low back. You're going to put your feet hip-width apart, stand with your hands, your fist right on those 2 little bony prominences on your back, and you're going to look up, and you're going to extend backwards and come up, and extend backwards and come up. You're just going to come to a comfortable stretch. This is good because what you're doing is actually forcing fluid into the spine. You're stretching all these front body muscles that have been contracted down for 8 hours a day. But this is also a great exercise for the abdominal, this lower abdominal area that women so often are trying to get strong after childbirth. This is a great way. In order to fully strengthen the core muscles, which are your abdominal muscles, you need to take them in full range of motion. And that actually is backwards. So when you're doing this, you're going to extend back and come up. Extend back and come up. You should not be in any pain. You should do this just to your comfort level and try to do it 15 times. The next exercise that we're going to talk about is opening up those pec muscles. Probably a lot of you have seen this exercise before, but not many people are actually doing it. And what we're going to do is you're going to stand in your office door, just like I'm going to stand in mine. And you're going to stand here. Put your arms just shoulder length apart, shoulder height. And you're going to just gently walk forward till you begin to feel the first pull in the pec muscles. You should not be in pain again. You're going to stand and you're going to take a breath in. You're going to breathe out. On the breath out, you're going to move forward just a little bit till you feel that next stretch. The reason we breathe in and we breathe out, the breath in will cause all those muscles to contract. That's a natural reaction in the body. The breath out causes all the muscles to naturally relax. It's on that relaxation mode that you're going to walk forward and bring it a little bit further. And you'll begin to feel the stretch. You're going to do it again. Hold this position for 15 seconds in the stress part. Breathe in, breathe out. And you're going to move forward again. So you're going to try to do this simply 5 times. The last exercise that I'm going to recommend is for the hamstrings. The hamstrings are very important for people that sit a lot. There's 3 different bellies of the hamstrings, and hamstrings, I'm talking about the muscles in the back. They come and they attach right underneath the bottom of the butt cheek. And part of what happens with it when you sit is this muscle begins to contract down. And what happens with that is when this hamstring contracts, it pulls the pelvis down. And when the pelvis gets pulled down like this is where the hamstrings attach, the pelvis gets pulled down like this and rolls backward and starts to flatten the spine. And again, you're inviting disc herniations when the spine begins to get flattened. You want to maintain the curve at all times. So doing a good hamstring stretch for somebody that's been sitting all day long, 8 hours a day, is a very necessary thing in order for healthy back. The hamstring stretch is something everybody has probably again seen as well. And you can simply do it standing at your desk. You want to keep your hips forward like this. Don't twist this way. It's a great exercise to stretch the adductor muscles, but not doing a whole lot for the hamstrings. So keep your pelvis pointed this way. And the foot flexed if you can. You can be on the phone in a business meeting and slowly take a stretch. It's the same concept of doing the pec exercises. Anytime you want to stretch a tight muscle, you're going to take a breath in. You're going to go down to the barrier. You're going to hold it there for 15 seconds. It's just a gentle stretch you may feel. And on the breath out, you'll go down to the next barrier. Now with hamstring stretches, don't make the classic mistake where you can't reach far enough, so you start doing this. Because what's happening with that is you're straining the back. So you're going to keep the back in that curved position, and you're just going to take it as far as you can. Again, hold it, 15 seconds, take a breath in, and breathe out. And you're going to turn and do the exact same thing with the other leg. You might just do this one time each, because we're trying to get good enough with these exercises that you can fit it all in 5 minutes. If you do it daily, it should become rote for you. I ask my patients to do this once an hour in an 8-hour workday. If I can get you to do it 2 to 3 times in a workday, I would be thrilled. Just so you can take your body out of those dangerous motions of flexion that you spend all day long. So an ounce of prevention goes a long way. Don't wait for your body to put you in pain to remind you that you need to do those exercises. It's much harder to get you back to a healthy state once the body has already begun to get contracted and put you in pain than it is to keep you healthy. My name is Dr. Venus Salemi, and if you'd like more information about our clinic, you can go to www.drsalemi.com.